Question number 11, Grant Robertson.
Thank you, Mr Speaker. My question is to the Minister of State Services. Is it government policy to move resources to the front line in the state sector?
The Honourable Tony Ryall.
Mr Speaker, yes, this government wants to see people and funding move into areas that will deliver best value for money and improve frontline services for New Zealanders.
Grant Robertson.
Does he agree with the nurses' organisation in response to his ministerial review group report? I quote, "The reality is that if health services were run without good managers and administrators, then nurses and doctors would be lost in the chaos."
Honourable Tony Ryall.
Oh, well, certainly there is a very strong role for ward clerks, etc., in supporting the work of doctors and nurses. But the problem that the government has inherited is that the number of managers and administrators in the public health service has grown from 8,000 to 10,500. On top of that, we've got 1,500 in the Ministry of Health. And what the government has sought to do is to slow that growth, and that in itself has been a great achievement.
Jackie Dean.
Thank you. To the Minister, has the government heard any examples of government agencies shifting resources to the front line?
Honourable Tony Ryall.
Mr Speaker, well, actually, yes. In Budget 2009, the government announced funding of over 700 additional frontline positions at the Department of Corrections and 600 at Police. The Minister of Social Development, the Honourable Paula Bennett, has also recently announced that additional funding for 300 frontline roles at the Ministry of Social Development, and 100 new positions, Mr Speaker, have been created at the ACC.
Grant Robertson.
Can the Minister guarantee to nurses throughout New Zealand that the reorganisation of the health system being proposed by his ministerial review group will not lead to them spending more time on administrative work and less time with patients?
The Honourable Tony Ryall.
Mr Speaker, I think there is a very serious issue that our nurses aren't spending enough time with patients. And, for example, the average nurse in New Zealand was spending a very low percentage of their time in contact with patients. I'm going to visit a ward at Tauranga Hospital on Friday, where through nurse leadership they have increased their contact time with patients by over 50%.
Grant Robertson.
Will the Minister guarantee to the House today that as a result of the reorganisation of the health system being proposed by his ministerial review group, that nurses will not spend more time on administrative work and less time with patients?
The Honourable Tony Ryall.
Mr Speaker, I can tell that member and I can give them this guarantee. This government will not approve any recommendations that increase bureaucracy or do not improve frontline services. What this government indicated before the last election is we didn't want another round of distracting change in the health system, where we went from hospital boards in 1988 to area health boards in 1989 to Crown Health.
Point of order, Grant Robertson.
Mr Speaker, I asked Mr Ryall the same question twice because he didn't answer it the first time, and he hasn't addressed my question the second time either.
What I'll invite the member to do is repeat his question, and the House will listen more quietly to both the question and the answer. I thank members. Grant Robertson.
Mr Speaker, can the Minister guarantee to nurses throughout New Zealand that the reorganisation of the health system being proposed by his ministerial review group will not lead them to spending more time on administrative work and less time with patients?
The Honourable Tony Ryall.
I can give that guarantee because the whole purpose of this government is we've inherited a situation where in most of our hospitals, nurses are only spending about a third of their time with patients because they're spending the rest of their time doing all the paperwork and bureaucracy that government put in place when they were last in office. And that is why we are looking to clinical leadership, to our doctors and nurses, assisting the government in improving the productivity of the New Zealand Public Health Service.